the community here, the Tohono O'odham Nation, actually heard from the people themselves saying, bring our elders home.
Frequently what we find when we do needs assessments is that there's the need that's been expressed by the community, and then there's underlying needs that come out when you do, whether it's interviews or surveys or focus groups. That's really the first, if not the initial step, but one of the first steps one does before they develop or design a program.
Culture is the first thing that we thought of when we started thinking about building a facility. Right up front, the advisory group said we need to have our own people working here, number one, because they speak the language.
I think it's important to look at the other resources, and that's one of the things that we continue to do, is look at third-party resources in terms of our operation to minimize the outlay of the tribe.
We really look at partnerships to help us, to support us, and especially now because I think we've realized that we can't do it by ourselves.
One of the concerns that we've always had is sustainability of the facility. We know that grant sources has a limited life, so we look at grants only to help us in certain areas, like one-time need, for example. We bought our vehicles, handicap equipment, paid through a grant.
So to sustain the program, there's the actual funding support that comes from the tribe, but there's also the opportunity to go out and look at what other means of support there is. So in the instance of this organization and these programs, we do access Medicaid, Medicare, veteran services, some amount of health insurance, but we also do other types of projects that include grants and direct services to help sustain the operations of the program.
Home-based services in the community are coordinated through our Desert Pathway staff and the Indian Health Service providers to a large extent. They still are the ones that write the orders for the patient for any equipment that's needed, for any medication changes that are needed, anything else that needs to happen to coordinate that care. Our staff becomes the eyes and ears that go out to the house and see the patient, but we work with them to put together a care plan and to be sure that that care is delivered properly.
What's occurred over the past few years is that the role of a nursing home has changed immensely. So the Archie Hendricks Skilled Nursing Facility does as much, if not more, post-hospital short-term care, rehabilitation, wound care on a short-term basis as they do long-term care.
We do have some benefits from sort of an economy of scale in being related to the nursing home, that I can order supplies that I need for my hospice patients from the same company and attach them to the nursing home orders, so we don't pay shipping and handling, that sort of thing. So I would encourage anybody that's looking at it to figure out what sort of relationships that you can work with other organizations that can help you cut some of your service costs. The Tohono O'odham Nursing Care Authority Board is actively working with other tribal programs to really develop the tribal work pool.
Staffing and operations and then retention often is the larger challenge. Especially if, for example, where we are, we're conservatively an hour and a half to 2 hours from any major metropolitan area. So the other element of that in this instance was it's necessary to have staff housing for us. Many of the projects that I've seen not succeed might have succeeded if they had had staff housing on site, so that there was ability to pull from that group.
We incorporate community members into what we're doing in a couple of different ways. Medicare hospice requires community member involvement to maintain that certification, and so we have a cross-section of community members that meet regularly as a community advisory group to give us some thought and some direction, and then also to be our voice out there in their communities, educating the people that they know about the services that are available. And then we also, under Medicare, use volunteers that are just community members that care and want to come alongside a family that is having serious illness, just to sit with a patient or call the caregiver once a week or whatever is needed to make that a little easier.
You need a passion. You need champions. You need people who will stay with it through the thick and thin, and there's a lot of that. You also need your tribe behind you, your council, because they're the ones with the money. And we're very fortunate that we have a nation who believes in caring for the elders, who also believes in education, because those are the two areas that require a lot of funding, is education and care of the elders.